Ray Joyce is excused. McLaughlin. Beston.
Here.
Miller.
Present.
Petto.
Here.
Robinson. Ward. Collins.
Here.
And Lockhart.
Here.
You have a quorum.
You'd like to read it?
The first item is approving the previous meeting minutes.
Your motion, Mr. Beston. Second, Mr. Collins. All those in favor? Aye. Opposed? Motion passes.
Items 2 and 3 are tabled at request of sponsor. Item 4 is authorizing an agreement with the New York State Department of Health regarding the tobacco enforcement program and amending the 2024 Department of Health budget. The Commissioner of Health and Ransom Moore are here this evening.
Deputy Commissioner.
Great to see you. Thanks for coming.
My name's Dr. Mon Simmons. I'm the Deputy Commissioner. I'd like to introduce that Albany County has received a continued grant funding from New York State Department of Health. The smoking has a significant modifiable risk factor for chronic disease, and adults who smoke start in their teens, so the ARTUPA program is specifically designed to help reduce teen smoking. The grant is provided to us has $103,000 annually for the next 5 years, and we are seeking legislative approval to accept the grant and enter into contract with the New York State Department of Health. Additionally, we'd like to amend our 2024 budget to reflect the $10,000 increase funding for each year thereafter. The funds are crucial for supporting all of our inspections that we've done for the 310 retail tobacco shops in Albany County. Thank you for your consideration.
Excellent. Does anybody on the committee have questions? I'd just like to make a statement, which obviously I've talked to you guys before. This is right up my alley. This is something I think is really important. It's great to have these laws, but enforcement is the most important part of that. So to say that we're getting some money to be able to do some of these things, get into the places and stopping, not just the tobacco, but again, for me, the vaping part of it and keeping vapes out of youth hands as much as possible. So do the best you can with this money. We appreciate it. It's great.
Thank you.
Have a motion? Mr. Beston, second. Mr. Collins, second. All those in favor?
Aye.
Opposed? Motion passes. Thank you.
Thank you.
Item 5 is authorizing the submission of a grant application to the New York State Office of Mental Health regarding the Adult Critical Time Intervention Teams Grant. Dr. Giordano is here this evening.
Good evening. I'm here with Deputy Director Hoffman and Associate Director Fitzgerald, who I think you've all met. They're here to prop me up if I falter. We have a couple of things before you this evening. The first is a grant. Actually, there are three, Mr. Miller, there are three grants this evening. They were all submitted since we've seen you last. We're in a very tight timetable when we find out about these to get on the RLA calendar. And so we're hoping that you are in support of these. We will come back to you if and when we get awarded, and you will have another chance to express your opinions on this. So this is a grant from the New York State Office of Mental Health. It is a 5-year grant. It's $825,000 plus annually, and it is a critical time intervention grant. You've heard me talk many times about the challenges in our system in the hospitals and the increased need for our high-risk, high-need, and high-cost, frankly, patients as they come in and out of the hospital. This critical time intervention is a model to try to get teams of professionals to people in those moments of transition so that they get to the services that they need and hopefully benefit from them. The interesting thing about this grant is that the state is hoping that this, over the course of the 5 years, will be medicatable, so that ultimately by the end of this grant, these services will be reimbursable. So this is kind of like a kickstart for this. So we hope that sustainability could be addressed at the back end with ultimately it being a Medicaid service. At any rate, we are hoping that this is something that you see the benefit for as well.
Excellent. Any questions from the committee? I will say again, this is perfect events tonight for these two things, but as you guys know, this is one of the things close to that I ran on one of my big topics. So we're 2 for 2 tonight on topics, so it's wonderful to see this as well and get it out there. I know. This is right up what I ran on. It's one of my campaign issues, so for sure. No other questions? Any motion to accept, please? Mr. Collins? Ms. Petto, second. All those in favor, please say aye. Aye. Opposed? Motion passes. Thank you.
Item 6 is authorizing the submission of a grant application to the New York State Office of Mental Health regarding the mental health outpatient treatment and rehabilitative services clinic enhancements grants.
Thank you very much. So this grant is through the New York State Office of Mental Health as well. It is a one-year grant amount of $250,000. It is an opportunity to enhance our current clinic services down on at our Green Street clinic. The MAHODERS acronym is a new way the state is describing our services, mental health outpatient treatment and rehabilitation services. That is our clinic downtown. And what we're hoping to do with this is to address the needs of immigrants and migrants in our community. And we're hoping that if we're awarded this grant, we would be able to hire an additional clinician and train them in dealing with the variety of folks that are in our community with mental health needs that might be going unaddressed. So again, we hope that that's something that you would see the benefit of.
Excellent. Ms. Martin?
Thank you, Dr. Giuliano.
Yes.
You mentioned the different people populations that you would be serving, and they would be served in the clinic in the South End?
Yes.
Now, for the migrant population, does this include transportation services for them? How would they get there?
Sure.
So actually, there's ancillary funds attributed to this grant as well, so we would have money for transportation, whether that be bus passes or even potentially contracting with the shuttle service to be able to transport them to services. But also, we have programs in the clinic now that go into the community, so theoretically, we could go on site and meet them in the community as well and offer support that we wrap around them on site, wherever they are.
Would this increase the number of people that you would serve? And do you have an approximate number of, right now, how many people you serve?
At our clinic right now, we're above 600, and this would, we would be increasing it accordingly. We would add one case clinician. That could be a caseload of 60 or 70 additional people.
Yeah, so some of that depends on the degree of intensity that the individuals might need, because we want to make sure it's quality over quantity and that they're getting the care they need. So a caseload might be as much as 60 to 70, but it could be smaller if the individuals needed more flexibility and nimbleness with the frequency where they receive services.
And my final question, do you categorize the people in terms of what sector of the community they come from? So if I were to ask you geographically where they came from, or if they were indeed immigrant or migrants, would you be able to clarify that?
We each year do a full analysis of zip code of all the people that we're serving and the degree to which different geographical communities are receiving services from us. So we would continue to do that here. And we break that down as best we can demographically in terms of, race, age, cultural background, and all that. So yes, we have that information, and be glad to share that. Actually, it's pretty. I'm always encouraged by when I look at that, because I do think that our services serve our community.
Thank you.
Well,
Thank you.
Thank you. Any other further questions? A motion to approve? Mr. Beston? Second, Ms. Bennett? All those in favor? Say aye. Opposed? Thank you. Motion passes.
Item 7 is amending the 2024 Department of Mental Health budget for reentry grant funding. Dr. Giordano?
Yes, thank you very much. So this is not a new grant. I've been coming to you for many years now asking for approval to renew our reentry grant, which is through the Department of Criminal Justice Services. As some of you may recall, we are one of 20 counties that has a prison reentry task force, and the grants run through September 30th each year. And what we're asking for here is, as we're approaching the last stage of this year's grant, to reallocate some money within the funding so that we can devote it for incentives for increased success and take it away from, I think we're taking it from travel and mileage. So this is a $14,500 transfer within our reentry grant, which you've already approved, but we want to make sure that we optimize use of these monies before the year's up.
Excellent. Any questions from the committee? No? Motion to approve? Mr. Besson? Mr. Collins, second. All those in favor? Aye. Opposed? Motion passes. Thank you.
And item 8 is authorizing the submission of a grant application to the United States Department of Justice regarding the Justice and Mental Health Collaboration Program grant.
Right. Thank you again. This is, indeed, it's the United States Department of Justice, the Office of Justice Programs, and the Bureau of Justice Assistance. And this is a really interesting opportunity to increase our work in the community with folks who are criminal justice involved. What we're hoping that we can do if we receive this award is to kind of mimic the prison reentry program that I was just talking about, but for our jail population. We're limited with our prison reentry program for folks returning from state prison. We know that we can help folks connect to services that they need and to help their landing back into the community. We've never been able to do that successfully with our jail program in our county. So this is a $550,000 grant over the course of 3 years. And one of the beauties of this is that we hope that there is enough flexibility in the way this can be staffed that we can address the issue that many of you were at last year at the press conference. We were talking about expanding our mental health court. These positions can be generalizable and transferable, so that we're hoping that we will work with our probation department and our mental health court to address the jail re-entering population.
Excellent. These are all great opportunities, absolutely, and hopefully we get them, of course. And
These are really great opportunities.
if we do, I'm sure we'll have some more specific questions about them when they come up, but great opportunities. Thank you for looking out for that. Mr. Blackman?
Is this a, thank you, Mr. Chair. Is this a one-time, or do you anticipate this being
Yeah, so this is, it's over the course of 3 years, and we, the issue of sustainability is always a challenge. We think that the benefits to the system are so significant that, we'll address that question as the grant proceeds, but it's over the course of 3 years.
This particular grant, it is certainly possible that it would be offered again and that it would be renewed. It's just unclear at this point, but that's certainly a possibility.
But if this were to go through, and let's say the grant didn't come back in, but it's a successful program,
Right.
That's the kind of thing you start making decisions, how do we fund it internally, right?
That's right.
Right.
This would really give us an opportunity to prove this concept for
Right.
3 years.
Excellent. Outstanding. Any other further? Yes, Ms. Lockhart?
Are you going to, Doctor, are you going to use the existing reentry task force to do the case management?
Yeah, that's a great question. I think right now, we're limited how the funds are spent on the prison side, but there will be a lot of the same players involved, and I was hoping that when I said we would mimic that, we would integrate that.
Yeah, so actually, this particular grant allows the hiring of 3 staff. It allows for the hiring of a case manager, a peer, and also a mental health assistant. So it would have a fairly robust team in and of itself, but as Dr. Giordano mentioned, the funding for the DCGS grant does not allow us to use their resources. That said, though, we are attendees at that task force and certainly could announce and collaborate with those partners.
Yeah, I think you've been to that task force meeting. That is
That was a member when it originally started.
Okay.
Thanks.
Okay.
Yeah, so we have only gotten stronger and grown, and all of those partners would be the same ones we would want to come to this table. I would like it to be the same table, but we would have to be.
Right, but we can use those networking relationships in order to further the goals for the jail reentering population, absolutely.
And forgive me, I should know this, but who's the, I'm sorry, I'm just
No,
doing
keep going.
something, I'm sorry. Who's the director or right now of the existing reentry?
So we have a reentry coordinator.
Coordinator, I'm
Erica
sorry,
Anderson is on our staff, and she is the point person for the county and oversees the task force.
Can you tell me her name?
Erica Anderson. I'm
Oh,
sorry.
okay.
I wasn't. finding it.
Okay, thank you.
Yes, she's wonderful.
There's been a few over the years.
I
Yes.
know. And forgive me for forgetting that you were with us at the beginning, but Erica has been with us for a couple of years and doing a great job.
Thank you. Thank you.
Any other further questions? Okay, motion to accept. Mr. Besson, thank you. Ms. Lockhart, second. All those in favor? Aye. Opposed? Thank you, motion passes. Thank you for your time, guys. and
Yeah, that's
appreciate
very
it.
kind of
Great
you. We
work.
hope to come back with the awards.
We hope you do too.
And we could talk some more.
Excellent, outstanding. Appreciate your time tonight.
No further
No further items. Excellent. Got a motion to adjourn. Mr. Besson, Ms. Lockhart. All those in favor? Thank you so much.
Thank you. Good job. I was